Question number 1. A kind of play which can be observed in infants. A. Associative play. B. Parallel play. C. Onlooker play. D. Unoccupied play. Answer D. Unoccupied play. Unoccupied play can be seen in infants, solitary play and onlooker play in pre-toddlers, parallel play in toddlers, in associative play in preschoolers, cooperative play in preschool and school children. Question number 2. A seborrheic resting over the scalp of newborn is known as A. Cradle cap, B. Granuloma, C. Mongolian spot, D. Salmon patches. Answer A. Cradle cap. Whitish or yellowish crusty or oily scaly patches on a baby's scalp is called as a cradle cap. Mongolian spot is a congenital dermal melanocytosis caused by the pigment in the skin. Granuloma, mainly umbilical, is the formation of a red ball-like tissue after the fall of umbilical cord on belly button of a newborn. Salmon patches is a common type of birthmark due to dilatation of capillaries. Mainly seen on face, it is known as angel's kiss, and when it is on the back of neck, it is known as stork bite. Question number 3. Moro reflex disappears at which age? A. 6 months, B. 4 months, C. 3 months, D. 8 months. Answer B. 4 months. Rooting reflex disappears 3 to 4 months when awake and 7 to 8 months when asleep. Sucking reflex begins to diminish at 6 months. Swallowing reflex, gagging reflex, sneezing reflex and sucking reflex, blinking reflex does not disappear. Doll's eye disappears when fixation develops. Palmar grab diminishes in 6 weeks to 3 months. Stepping or dancing reflex disappear with 3 to 4 weeks. Moro or tactile reflex strong up to 2 months and disappears by 3 to 4 months. Question number 4. Which drug is relatively contraindicated in breastfeeding? A. Propranolol, B. Sulfonylurea, C. Cephalosporin, D. Pseudovodin. Answer D. Pseudovodin. Propranolol, it is an antihypertensive drug. It is contraindicated in cardiogenic shock, sinus bradycardia and greater than first degree block, bronchial asthma and hypersensitivity. Sulfonylurea, it is an antibacterial and it is contraindicated in hypersensitivity reaction and pregnancy. Cephalosporin is an antibacterial drug and it is contraindicated when severe immediate allergic reaction to penicillin, carbapenems or cephalosporin. Pseudovodin is an antiretroviral drug. It is contraindicated in anemia, breastfeeding mother, low level of neutrophil, myopathy, kidney failure, liver disease, loss of vision and muscle inflammation. Question number 5. Which type of neural tube defect shows tuft of hair? A. Spina bifida occulta, B. Spina bifida cystica, C. Androcele, D. hydrocephalus. Answer A. Spina bifida occulta. Spina bifida occulta, it is a defective closure of vertebrae, usually L5 and S1, without protrusion of the meninges. Spina bifida occulta may be presented with a tuft of hair or cutaneous lesions over the defect, lipoma, hemangioma, dermal sinus or as a dimple in the skin. Spina bifida occulta, due to the defective closure of vertebrae, a cleft forms on the defective part and the meningeal membranes and spinal cord is clearly visible through cleft. Androcele, herniation of the peritoneal sac containing small bowel or sigmoid colon between the vagina and the rectum. Hydrocephalus, an accumulation of cerebrospinal fluid CSF in the ventricle within the brain. Question number 6. How many hours breast milk can be stored at room temperature? A. 4 hours, B. 6 hours, C. 2 hours, D. 8 hours. Answer A. 4 hours. Freshly expressed or pumped breast milk can be stored up to 4 hours in room temperature if the room temperature is 25 degrees Celsius or colder. It can be stored for 4 days in refrigerator if the temperature is 4 degrees Celsius. It can be also stored for 6 months to 12 months in freezer if temperature is 0 degrees Celsius. Question number 7. Doppler's effect can pick heart rate by A. 12th week, B. 8th week, C. 6th week and D. 10th week. Answer C. 6th week. Question number 8. According to WHO, no birth weight means weight less than A. 2.8 kg, B. 2.5 kg, C. 2.7 kg, D. 2.3 kg. Answer B. 2.5 kg. Extremely low birth weight ELBW, babies with birth weight less than 1000 gram. Very low birth weight VLBW, babies with birth weight up to 1500 gram. Small for date babies SFD means babies with a birth weight less than 10% for the gestational age, also called as intrauterine growth retardation. Appropriate for dates AFD is babies with a birth weight between 10th to 90th percentile for the gestational age, also termed as appropriate to gestational age. Large for dates LFD babies, birth weight of the babies more than 90th percentile for the gestational age. Question number 9. Stillbirth rate includes babies dead after A. 28 weeks, B. 24 weeks, C. 32 weeks, D. 20 weeks. Answer D. 20 weeks. Abortion after 20 weeks is considered as stillbirth. Abortion before 20 weeks is considered as miscarriage. Question number 10. The nurse analyzes the laboratory result of a child with hemophilia. The nurse understands that which result will mostly likely to be abnormal in this child. A. Platelet count, B. Hematocrit level, C. Hemoglobin level, D. Partial thromboplastin time. Answer D. Partial thromboplastin time. Hemophilia is a group of bleeding disorder resulting from a deficiency of specific coagulation proteins. Partial thromboplastin time measures platelet function. In case of hemophilia, abnormal clotting factor or prolonged partial thromboplastin time would be the result. Question number 11. The nurse is providing home care instructions to the parents of a 9-year-old child with hemophilia. Which sport activity should the nurse suggest for this child? A. Soccer, B. Basketball, C. Swimming, D. Field hockey. Answer C. Swimming. As we discussed before, hemophilia is a bleeding disorder due to the deficiency of specific coagulation protein. So the child should avoid contact sports or should take enough precautions like helmets, wearing elbow or knee pads, etc. Among the given sports, swimming is safe for the child. Question number 12. The nurse is instructing the parents of a child with iron deficiency anemia regarding the administration of a liquid oral iron supplement. Which instruction should the nurse tell the parents? A. Administer the iron at meal times. B. Administer the iron through a straw. C. Mix the iron with cereal to administer. D. Add the iron to formula for easy administration. Answer B. Administer the iron through a straw. In iron deficiency anemia, due to iron depletion, the iron supply required for the formation of a hemoglobin in red blood cells also decrease. Thus, oral iron supplements are administering. For children, it would be in liquid form, and this liquid iron supplement results in staining of the teeth. So, the medicine should be administered through a straw and it should be placed at the back of the mouth. Parents should be advised to brush the teeth or wipe the teeth after the medicine administration. For easy absorption of iron supplement, it should be given in empty stomach or in between the meals. Iron should not be given with milk or formula feeds. Question number 13. Birth weight of the baby triples by A. 1 year, B. 6 months, C. 1.5 year, D. 2 years. Answer A. 1 year. Birth weight doubles by 5 months of age, triples by 1 year, 4 times by 2 years, 5 times by 3 years, 6 times by 5 years, 7 times by 7 years, and 10 times by 10 years of age. Question number 14. Which drug is used for the closure of patent ductus arteriosus? A. Dopamine, B. Phenobarbital, C. Indomethacin, D. Immunoglobulin. Answer C. Indomethacin. Intravenous indomethacin or ibuprofen is administered for the management of patent ductus arteriosus in neonates and premature babies. Patent ductus arteriosus is the persistent vascular connection between the pulmonary artery and the aorta. Question number 15. Which vitamin deficiency in antenatal period causes neural tube defect? A. Vitamin D, B. Vitamin K, C. Thiamine, D. Folic acid. Answer D. Folic acid.
Thank you for watching this video. Please like, share and subscribe for more videos.